Hi, this is Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. Something that we get asked all the time is, how does heart disease present differently in women? A diagnosis of heart disease comes from talking to people, taking an adequate history, taking a complete history. Everybody describes their symptoms differently. I've had patients tell me they feel like there's a bug crawling around in their chest. I don't know what that feels like, but at the end of the day, you shouldn't have that feeling of a bug crawling around in your chest. Women tend to get more fatigue. Men tend to get a little more heaviness in the chest or shortness of breath, but it does cross from one sex to the other. I wouldn't necessarily ignore any symptom that somebody has that they shouldn't have. When we look at heart disease, we think about what's causing the pain or the discomfort, because many things can cause pain in the upper chest. Peptic ulcer disease, gallbladder disease, coronary artery disease, also other things like certain viruses. You can have viral pericarditis or viral pleurisy, inflammation of the lining or hearts or lungs, and also blood clots can do it. So pulmonary embolus. When somebody presents to us with symptoms that are new or different, we always work them up. Women tend to have more false negative stress tests, so we would typically go with a nuclear stress test or a CAT scan of the heart. Of late, there's been a fair amount of literature coming out that women tend to have a worse outcome with heart disease than men, and a lot of it is attributed to them not recognizing symptoms earlier, or the medical staff not recognizing the symptoms earlier and not being treated as aggressively with cholesterol-lowering medications. So to summarize, I think that women have slightly different symptoms than men, but I wouldn't ignore any symptom until it was worked up, because heart disease can present with many types of symptoms. Aggressive risk factor control, whether you're female or male, is of paramount importance, as well as other risk factors.